Ethics, I think, informs everything that we do. It's not just in these moments of conflict, and it's not just when there's a matter of life and death and it's obviously complex. I think ethics dictates how we engage with each other, how we care for each other, how we judge each other, right? How we communicate. And I actually don't think it's an understatement to say that ethics is the fabric that holds, or that has the potential to hold modern healthcare together, or has the potential to completely rip it apart. With modern technology and the way we ratchet up our tolerance, the way we ratchet up our experimentation and how things expand, it's hard to come back again, right? So when we have an ethical underpinning, we can maybe intentionally create the kind of future and present that we want. Maria introduced with some slides that had some examples of ethics, and I really liked those because they were tangible, they were real, they were concrete. But I also thought of them as kind of low-hanging fruit. You know, these are like the obvious things. Of course, we need to think of things ethically when there's a problem. But I put out to the room and I asked myself, just because we all agree on something, does it mean it's the right decision? Does it mean that it was ethically considered? I mean, I think we all know that horrible decisions can be made by groups of people who all agree on things. While conflict is an indication that ethics can be brought in, it's not the only one. And in fact, my personal feeling is that if decisions are arrived at too quickly, or if, in this context, let's say a treatment or a therapy is offered and the family says, yes, 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 that's great, maybe that's actually another kind of red flag where this particular option has not received its day in court properly. You know, maybe we haven't hashed it out enough if there is no tension or there is no conflict or there is no debate about it. I'd read a fantastic article recently, a couple months ago in the New Yorker, that revealed this study that was done about brainstorming. And, brainstorming is this great tool that we all use. We put the sticky notes on the wall and everybody contributes and we all do this brain dump of ideas, right, if we're trying to come up with a creative solution. And this article was suggesting that that kind of environment is actually the least creative, it produces the least creative output because nobody's challenged on anything. And that's actually the number one rule of brainstorming, right, is don't criticize, don't, we all just shout it out and volume is what we're going for. We want quantity and eventually quality will surface. But when they did this study, they discovered that that was actually much less effective than if an environment of debate was set up. So I found that interesting in this context because in decision-making in healthcare, we don't raise alarm bells until there's conflict. There's a lot of emotions involved, and so we often want to go with a path of maybe not least resistance, but a well-worn, tried and true, this is what we do. Parents, as I'm going to speak to, are maybe not getting what they need in order to make the right decisions for themselves. I started out very, very naive, and as all parents do, and you start to see my skepticism grow. You start to see the absurdities speak a little louder. You start to see, the wisdom, I guess, come out. I was more comfortable with the decisions I made when I was more skeptical and when I was engaging debate and when I was really asking the hard questions of why as opposed to just what and how and when. And I was, the first one to say, yes, let's keep going, let's keep doing this. And my going along with things was taken as, well, of course, a positive thing. It was nurtured, it was rewarded by, okay, great, you're doing well. And I felt like I was actually a student at school learning new things and then applying them. And I never once stopped to come out of that at all. And I think when I look back now, that was a kind of a stress response. This was my way of taking a little bit of control over something I couldn't control. I remember meeting other parents too who had very different types of reactions. Some would be very emotional, depressed. They would have a very hard time envisioning positivity in their lives with their children. And then there's the kind of parent that emerges very dominant and domineering, argumentative, voracious readers. And I was probably each of these things at different points in my early days with Owen. I think of these all as stress responses. Regardless of how we analyze these parents or myself or anything, inarguable truth in all of this is that these parents are completely naive, completely inexperienced, really have no idea what's coming, regardless of what they've read, regardless of what they think they're going to feel, regardless of anything. They just don't know. And yet, we're only working on this level of responding to the personality as opposed to seeing underneath this immense lack of experience. When in my mind's eye, I picture, the whole group of parents that I was kind of a cohort with when Owen was younger, and it was just all pleading, pleading eyes looking to healthcare to help us, help us fix it. And regardless of whether we came out of the gates roaring like bulls or whether we, were crying through every single session, all of that was true. It's important, I think, to remember that. Last fall, I participated in a talk with some medical students, and the introduction to the talk was about family-centered care and some of the principles that are important to institutions like Bloorview and many others around participation and respect and collaboration. And I thought all of these things were, of course, important and great, and yes, parents need to be, of course, included. I mean, we don't even need to debate whether that's important or not. But it made me wonder how in this room of collaboration and in this room of participation, how capable is this group of coming up with the right decision given all of the dynamics that are going on? I think about myself in these early years, and I think about this collaboration and this desperation. Regardless of how I was behaving, I was desperate. So what I got back from healthcare is what healthcare is very good at. It was information, it was options, it was statistics, it was process, logistics. We can do this, here are the benefits and risks. We can do this, here are the benefits and risks. But when I think about what did I really need in those moments, was that information actually going to help me make a decision? I think the answer was maybe. Sometimes it was no. I remember evaluating some of these surgical procedures that we were thinking about for Owen, whether it was the cochlear implant or the intrathecal baclofen pump, the deep brain stimulation. Some we did, some we didn't. Statistics were an important piece, risks of the surgery, outcomes, all of these things, and they were all given to me from a clinical perspective. This was the institution's view on what was success. But I would look at these numbers and say, let's just make something up, 80% of children with X do better. What would go through my mind was, well, I don't have 100 children where it's okay if 80 do well and 20 don't. It doesn't matter. The risk is so high anyway, whether it's 20, whether it's 1, whether it's 100, it was not a useful number for me to contemplate. A good example just for me personally is, people do laser eye surgery all the time, and I'm just like, I will never let a laser touch my eye. I don't care what the statistic is, because if it doesn't work, it's not a result I can live with. So, I would get all this information, get overwhelmed, not overwhelmed, I can compartmentalize, and I was a good little student and I could absorb it all, but I was only reflecting on this information from a clinical perspective. I had no idea how I would actually feel when these things were done. I had no idea if I would feel that it was worth it. And in the end, with all these numbers, it actually felt like everything was kind of random, or maybe 50-50, or we would try one thing and be the non-successful group and try another thing and be sort of the successful group. And so it didn't actually help me to make decisions, to get more information of the same kind. I think what I would have loved was dialogue. I would have loved an ethics class. I would have loved to have sat in a room like this with parents coming through, telling how they felt in the same environment. There are 2 short passages I'm going to read with an 18-month time gap in between, and this is when we decided to have Owen implanted with the intrathecal baclofen pump. So I'm going to share how I felt after he'd had the pump implanted. And then my next piece is we actually had the pump explanted 18 months later. Owen's body was so small that the baclofen pump stuck out like an appendage. The outline of the hockey puck-sized device could be seen and felt through the skin, nestled snugly in the space between his right hip bone and lower ribs. If you put your ear to it, you could hear it ticking. I would never have admitted to regretting putting it in. Indeed, I had pushed for it, thought it a good preventive measure. And it did help. Owen was softer, looser, he slept more, actually slept much more. Still, I was deeply conflicted. And there were many reasons: the permanence of the device, the invasiveness of the surgery, the ugly scars and unpleasant post-op infection. But more than these reasons, I felt I had crossed a line. Owen was sleepy all the time, and when awake, his alertness and capacity to engage seemed greatly diminished. And I wasn't actually sure we had relieved any of his suffering. I wasn't sure he ever was suffering at all. I pondered an uncomfortable thought. Anecdotally, I knew of or read about people who had opted out of particular treatments because they would rather not medicate away their personality or their lucidity or their ability to take in the world. Would Owen have been one of them? Would he have chosen this for himself? I had gotten what I wanted. He was easier to manage. And I was sorry. I felt my regret most keenly on those occasions when we returned home from the clinic after having had the amount of medication adjusted. The regret followed me around day and night. I transmitted my regret to Owen every night while he slept. I like to imagine that he knew this and forgave me. The intrathecal baclofen pump came out 18 months after it was initially inserted. The procedures left a long, reopened scar on Owen's belly and a sunken space where the device had been. A small patch of puffy skin remained, which seemed to have trapped some extra fluid. The scar on Owen's back was less noticeable, but I could still feel a sinewy thread of tissue growth where the catheter had been. I would sometimes place my hand over his belly, completely covering the scar, and try to remember what he looked like without it. I chose these passages because it illustrates that, other than, of course, this health crisis that he had, which was dire, he was in intensive care for several weeks, seeming to be overdosing and underdosing on the baclofen. Other than that health crisis, things were going along fine. If you had surveyed me a week before he crashed, I would have said, yes, it's working. And that would have gone in the little check mark. It would have been, what was the record of the success of this procedure. And yet, I felt the regret all the way through, and I didn't anticipate that. There's no way that, in this setting, in healthcare, in the institution, or through the individuals, that I could have anticipated that. It's just not part of the story or the dialogue that gets reinserted, back down the chain to the parent when they're making decisions. Early on, I didn't give a lot of thought to decisions. I didn't think that I had to think too hard about things. We showed up at the doorstep of sick kids or here at Bloorview, and I felt safe. It felt like we were in the right place to be looking after these very complex needs of Owen's. Because, I'd look around me and I'd see 20 other kids who presented similarly and feel like, okay, this is great, we're in the right place. So whenever there was an option on the table, or whenever it was like, okay, let's try this next thing, it didn't feel like there was a decision I had to make, or that I had to pore over it, or that there was any reason to make my life more complicated. It was, yeah, let's give it a try. Let's keep moving along and see what happens next. So we would go along a path, and I'd sign up for something. We'd get to the end of the 6 months or the end of the year and think, oh, okay, he's really not doing anything. That was a bad decision. That sort of environment where you're not actually intentionally making decisions, but just going along with things, I found for me, it made me very attached to what the outcome was going to be, very focused on that. And that was really going to be the only way I would know I had made the right, chosen the right path earlier on. Over time, I started to divest from that attachment to the outcomes. It started to become more of a decision about, how do we want to live our lives in this moment? Does this make sense? What are our actual goals, rather than let's try? And why are we working so hard, and for what? What is it we're trying to get to? These little minuscule improvements that Owen would have over time were these little kernels of hope that, yes, okay, we're on the right path. He's getting better. But I would look back, 3 years later and think, oh my God, we spent so much time. It wasn't worth it. In hindsight, I can see that when I was making decisions that were not based on where I was in the moment, but were rather based on this kind of never-ending journey of hope, it was a complete setup for likely regret by the time I had moved my way through it. I remember this very poignant moment in my life. Owen was maybe 3 or 4. We were working through a bunch of augmentative communication systems, one after the other. I had met another family. It was a woman who didn't live too far from me. She had a son who was, now he's in his late 30s, maybe early 40s. So way, way ahead. And I started telling her about all these exciting things we were doing, and she laughed, and she said, oh, I got a drawer full of those things. And I met so many parents who, by the time the child hits 10, 15, 20, a certain amount of jadedness sets in, a certain amount of, yeah, I remember we wasted all that time doing that stuff. And I thought, that's the story I'm hearing over and over and over and over again, where, the success stories, the big magical success stories and the miracle stories are so few and far between. And so how is it that children and families with all these disabilities can make it to 20 and regret so much of what they spent their time doing early on? I don't have answers for that. I think, really the only thing I can point to is that when I started to make decisions based on how do I want to remember my time with Owen as a child? How do I imagine Owen would want to look back on his childhood? What did he spend his childhood doing? How would he like to remember that? What is his experience of me as his mother? How is he experiencing life? And when I started to ask myself those questions, all the therapy stopped. Everything went out, I don't want to say went out the window, but I made a conscious decision that no, this is not how I want this all to go anymore. And I'll admit too, it was this health crisis that made me realize that how we had been spending the last 8 or 9 years of his life was not how I wanted the entirety of his life to be remembered. So that was the decision point for me, was to appreciate that A, life is short. B, nobody ever looks back, I think, on their deathbed and wish they worked harder, wish that they had done more therapy with their kid. These were not governing principles for me. Which just reminded me, I said governing principles, these are all ethics, right? These are all how we choose to live our lives. Not only is ethics important to bring into dialogue and into our decision making and to encourage parents to think broader about how they're assessing information and how they're making decisions. But I would also go so far as to say that reality today is a result of our ethics that we have brought forward. What are the ethics that led the staff to give Owen his leadership award? How are they honoring Owen by doing that? And what are the principles they're applying in that case? I think it's important to remember that our actions and our decisions are a reflection of the ethics we already have. And so if we want to create intention, we want to set ourselves up to have less regret when it's all said and done, we can be more intentional about how we're behaving and how we're making decisions now. So I'm going to finish with another passage. About 6 months before Owen died, we were debating deep brain stimulation. And it was a debate that was really only going on in me. Owen's dad was flat out, absolutely not. We're done with implanted devices. But I felt a responsibility. I thought, I can't out of fear not look at this. It's just information. We're not making the decision. I just need to explore it. So I went to a meeting with the neurosurgeons who at the time were only operating out of Toronto Western because it wasn't a pediatric specialty here yet. So this internal dialogue occurs just after we left the appointment with the neurosurgeon. I knew before the meeting was over that we wouldn't pursue it. Michael had already made his preference clear. No more surgeries. In my own mind, I had dismissed this as too simplistic an answer, but I was coming around to his way of thinking. The very nature of the meeting, another instance of the pattern I had seen time and again, had put me off. When a patient has a complex or mysterious problem, the path of referral goes something like this. See a generalist, get referred to a specialist who knows the condition, get further referred to a subspecialist who does the operation for that condition. The scope of the problem and skill set of the practitioner become increasingly specialized the closer you get to the end of the referral chain, like being funneled through narrower and narrower pathways. The path of referral to any particular specialist can take months and sometimes years. The legitimacy of the path itself is not called into question at this point. The specialist assumes you've done your research and you, the patient or parent, are happy to have finally found someone with a solution. Following this path, the journey can feel like a single, inevitable trail leading to a final grand conclusion. With blinders on and a narrow focus, it's hard to see the full picture. The medical system is, in fact, a complex maze that could shoot an unwitting participant down any one of many dark tunnels that may end in any one of many possible chambers. Which chamber you end up in can be highly contingent on who you saw last, what they knew, what they read, how they chose to curate, editorialize, and distill the information at their disposal. I have heard some patients complain about physicians, about lack of compassion, about poor bedside manner, about unfortunate uses of certain words and terminology, about pessimistic prognoses. I've occasionally experienced some of these things, but I have no such complaints. I imagine that some medical specialties attract certain personality types. They are more like engineers or technologists or research scientists than they are like therapists or healers or counselors. To do what they do, they must be detached, curious, intellectual, and willing to fail. Naturally, it's reasonable to expect clarity, courtesy, and civility, but for me, anything beyond that is a bonus. Specialists often function in communities resembling special interest groups. They have their own funding, their own agendas, their own perspectives. Perhaps they are seeking to prove a thesis. Perhaps they hold a noble vision of advancing the profession, adding to a collective body of knowledge. They may be looking to develop an idea that has been years or decades in the making. A clinician may be trying to determine whether your case fits with what they have to offer. They're assessing to see if you're a good candidate and whether or not you and they are likely to experience a successful outcome. The problem lies not with this agenda. The problem is how a patient interprets it. If my son fits the profile and they say, yes, we can do it, it's tempting to assume that whatever they're offering is the right solution. Finer minds than my own have spent a lot of time and money focusing on this one specialty, and thank goodness for that. They solve mysteries, improve chances, and save lives. But the specialist doesn't have the time or inclination or maybe even the perspective to reflectively delineate the scope of his or her special interest. They simply do what they do. The neurologist looked Owen up and down, thinking out loud. She recited a high-level checklist, crossing each item off one by one. Fixed postures? No. Is he big enough? Yes. Parents understand the surgical risks? Yes. She said, well then, we can try. Yes, of course we can try. And it was good to know that DBS was an option. But our answer was no. I left that appointment practically skipping. I felt I had passed a test or resisted a strong temptation, not because we decided against the surgery, but because I knew we had reached the best decision for Owen, given everything we knew and all we had experienced, in spite of the forces moving us in a different direction. We decided that there would be no more surgeries, no more implants, no more invasive procedures. With this one decision, I enjoyed a surprising new freedom. There was nothing left to hold out for, no more straws at which to grasp, no more hope for improvement, no theories to explore, no further experiments, and no more trials. Finally, Owen was free to just be. And I have no doubt he felt just as much relief as I did.